Hello, I'm Jay Schloss, Dr. Edward J. Schloss. I'm the Medical Director of Cardiac Electrophysiology here at the Christ Hospital. And today I'm going to talk to everybody about heart rhythm disturbances, the electrical system of the heart, and we'll work our way into devices like pacemakers and defibrillators. So first I'd like to introduce to you, this is my model of the heart. Apologies for the art, but I'll do my best. We all know the heart's a big muscle, and any muscle runs on electricity. So imagine like when if you get a static electricity shock in your arm jerks back. The reason your arm jerks back is that the muscle from the static electricity activates, or the electricity from the static activates your muscle and causes it to jerk back. So any muscle, though it needs blood and oxygen to keep it healthy, it won't squeeze unless an electrical impulse runs across it. So my job as an electrophysiologist is to evaluate the health of the electrical system of the heart and do what I can to preserve good electrical health of the heart, which generally works out to taking hearts that beat slow and speeding them up, taking hearts that beat fast and slowing them down, and then taking hearts that beat erratically or out of sync and lining up the synchronization of the heart. So we'll try to touch on some of those issues today. So here's the heart. The heart has 4 chambers. We probably know this already. There's the right atrium, the left atrium, the right ventricle, and the left ventricle. The way the heart beats is blood goes into the atria first, comes from the outside of the body, what we call the systemic circulation, into the right atrium, so the muscles, arms, legs, everywhere, into the right atrium, and then is ejected into the right ventricle. From there it goes into the lungs, gets oxygen, comes into the left atrium, down into the left ventricle, and then ejected into the body. So this is the high pressure system and this is the low pressure system. So let's move on now and talk about how the electricity drives that process. There is a collection of cells up in the top right chamber of the heart that's called the sinus node, and that's the body's natural pacemaker. It has its own ability to fire on its own. It beats about once a second, and under influences from the body, like if you get scared and adrenaline flows, it'll speed up. If you're resting, like if you're going to sleep or relaxed or meditating, then neurologic influences cause it to slow down. So it'll speed up and slow down on its own. It fires and sends a signal out through the 2 top chambers, the right and the left atria. They collect blood and they squeeze in response to the electricity. They're not a major driver of blood flow through the heart, but they do add a little, we call it a kick to the contraction of the heart. As that blood is then ejected down through these 2 valves into the main pumping chambers of the heart, the electricity collects down in a collection of cells in the middle of the heart that's called the AV node. The AV node is the bridge between the top and bottom chambers of the heart, and it also is a delaying process. It holds the electricity for about a quarter of a second, and that is essentially allows the chambers to fill, and then the electricity is released through the AV node, through a series of what we call bundle branches, which if you think of it like wires that run out into the heart and then activate the heart uniformly with electricity. Anyone who's had heart disease or seen EKGs may have heard of the right bundle and the left bundle. Those are the 2 main branches that pass electricity through the heart. So if that system all works properly, then you get a nice coordinated heartbeat. The sinus node fires at the appropriate time with the appropriate heart rate. The AV node collects the electricity, delays it enough time for the blood to pass through the veins, through the valves, and then the 2 bundle branches will uniformly activate the heart so that you have a nice uniform contraction so it squeezes all together.